Hello and welcome to Health Dialogue Show. I'm Dr. Bhumika and today I welcome you all to this special awareness session on World Hypertension Day, observed every year on May 17th. Today we are talking about a condition that affects over 1 billion people globally, hypertension, often referred to as the silent killer. To help us better understand the risks, signs and ways to manage high blood pressure, we've invited a panel of leading experts. Through this conversation, we aim to bust some myths, highlight practical lifestyle changes, and empower you with the knowledge to take control of your heart health. Today, we have with us Dr. Mahesh Kumar, Dr. Romesh Menon, and Dr. Vsha Rakshitta with us. Dr. Mahesh Nalin Kumar is an MBBS, MD, DRNB, FACC, FESC. He's currently the HOD and Senior Consultant Cardiologist at St. Gregorios Medical Mission Hospital, Parumala. He has over 25 years of experience as an interventional cardiologist, performing 1,200 plus procedures annually in high-volume centers. He's serving as Consultant Cardiologist at Base Hospital, Delhi, Cant since 2006, managing complex cardiac cases with high success rates. He's a proctor for optical coherence tomography, subcutaneous ICD, intracardiac micra pacemaker. He's known for clinical leadership, training multidisciplinary teams, and adopting cutting-edge cardiac technologies. Next, we have is Dr. Romesh Menon, who is an Associate Director at Personal Genomics and Genomic Medicine at MedGenome. He brings over 18 years of experience in genomics and biomedical research across leading institutions in India and Europe. He has authored research publications in top-tier journals including Nature, Nature Neuroscience, and Nature Communications. He holds a PhD in Biomolecular Sciences from the University of Milan, Italy. He has completed postdoctoral training at the San Raffaele Scientific Institute and Hospital, Italy. He is recognized for significant contributions to personal genomics and translational research. Last but not the least, we have Dr. Vsha Rakshitta, Consultant, Department of Cardiology at Ramaiah Institute of Cardiac Sciences, Ramaiah Memorial Hospital. She's an MBBS, MD, DM, and has done fellowship in electrophysiology. Her areas of core expertise include interventional and structural cardiology, electrophysiology, leadless pacemaker, cardiac imaging, critical care, heart failure, cardiac transplant evaluation, and preventive and geriatric cardiology. Her areas of interest include structural heart disease and interventions, complex coronary interventions, electrophysiology, cardiovascular imaging, cardiac transplant, and heart failure management. She has presented several posters and papers at various conferences. I welcome all the three of you to our show today. It's a pleasure to have you with us. Okay, so my first question is to Dr. Mahesh. So what exactly is hypertension and why is it called a silent killer?
Yeah, thank you, Bhumika, and thank you for this initiative that you've taken for educating the general public. When the left ventricle pushes it's a muscle, it pushes the blood out. So the blood comes out with specific pressures so that we can measure at various levels. And this pressure which is exerted by the blood on the arteries because of the source energy from the left ventricle is called the blood pressure. You can use a sphygmomanometer to measure it. So blood pressure has been defined as anything below 120/80 to be normal, 120 to 129, 80 to 89 being stage 1, and 140 to 140 and 190 plus, up to 140 and 90 plus to be stage 2. Anything beyond that 140-90 is definitely hypertensive. If you have a single reading of 180, then it becomes very significant, and then you may have to immediately go on the medical management. Otherwise, you can try your lifestyle modifications and all that. So there is a pressure exerted on the arteries, and there is definitions laid out by the World Health Organization as to what is good and what is bad. Why is it called a silent killer? Because people may not manifest with, there is no, like you have a headache, you have a fractured bone, you have pain there. There is no specific symptom that is attributable to the phenomenon of high blood pressure. You can come with a stroke, you can come with a vision that's bad, you can come with a heart attack, you can come with a heart failure, you can come with a failing kidney and sexual dysfunctions. So it is a very difficult fellow to treat unless you keep yourself regularly monitored to diagnose that you have a hypertension, and it's very important to treat early once you have been diagnosed as hypertension.
All right, sir. Okay. So my next question is to Dr. Ramesh. So how can someone know if they have high blood pressure if there are no obvious symptoms?
Thank you. I think it's in continuation with what Dr. Mahesh has rightly pointed out. So it's a silent killer, and most cases there won't be any symptoms as such. But the screening, as per the recent guidelines, the scientific and medical guidelines, a routine screening and multiple observations above the thresholds that Dr. Mahesh has mentioned. So multiple readings at at a higher or a lower level, especially it happens at the higher to the threshold values. So one need to get the intervention done. So the practically how it is happening is like we either one can go to consult the clinician and get the measurement done, or nowadays these machines are available. One can check at home, and even nowadays many workplaces also have these BP measurement instruments that one need to screen regularly. Now the question, who should check it? So if somebody has having the family history of hypertension or any cardiac problems, or somebody is having a kind of a not very good lifestyle or sedentary or stressful job, such individuals should definitely screen regularly for hypertension. Yeah.
All right, sir. Okay, so that was very informative. My next question is to you, Dr. Varsha. Ma'am, at what age should people start checking their blood pressure regularly? Like, is it only for like an issue for older adults, or should young generation also should start monitoring themselves?
Okay, so I wouldn't really say that there is a specific age above which patients can have hypertension. Hypertension can, be there for patients even at the age of 80 years, or even patients who are as low as at the age of 20 years also can have hypertension. So when it comes to assessing or how frequently do people have to check their BP, usually we advise that patients above the age of 40 years, they check their BP once a year. But patients below that age, we advise them to check their BP once every 2 years or so. Now, generally, when we talk about hypertension, we divide them into two: primary or essential hypertension, and hypertension because of any other abnormality in the body. Now, primary or essential hypertension is the hypertension which can affect people at the older age, while secondary hypertension can be because of various abnormalities in the body. For example, if there's a thyroid problem, or in patients who have PCOD, patients who have problem in the renal arteries, all these can lead to secondary hypertension. Now, generally, secondary hypertension is the kind of hypertension which is there at patients who are below the age of maybe 35 or even 30. So like I said, hypertension is not beyond a specific age. It can occur in any age group.
All right, ma'am. So my next question is to Dr. Mahesh again. So what are some daily habits or lifestyle changes that can naturally lower blood pressure?
Most important is DASH. DASH is dietary approaches to prevent hypertension. Okay, so what is to be included is all the good things in life. Probably you have to avoid regularly, and all those old people recommendations of fruits and vegetables and vegetarian diet and that kind of things to be shut down. Your sodium should be less than 1500 grams per day, milligrams per day. That means that you should avoid processed food, cheese, pizzas, that kind of burgers, that kind of stuff. Again, then you should have regular exercise. Regular exercise is 150 minutes of exercise for an adult per week, out of which at least 60 minutes should be of weight training. You don't do just going for an early morning walk is good when you're 90. Before that, you have to do 120 minutes of good exercise. Your weight should be as per your BMI, kg per meter squared. 25 is upper limit of cutoff with lot of grace. Between 20 and 23, you're doing well. Anything above 25, make an effort to bring it down. Alcohol, they say 2 pegs for male per day, 1 peg for female per day. But my recommendation is avoid if you can. As far as possible, don't drink. If you are drinking, drink only 2 peg per day. Just because you have not had your weekly quota of 1-2 pegs per day, you can't have all the 14 pegs on a Sunday. You will crash. So, if binge drinking is to be avoided, minimum alcohol or no alcohol, that is this thing. Smoking, I don't even want to talk about it. There's no question of smoking. If you are lucky, you'll get a heart attack if you smoke. If you're unlucky, you'll end up with a malignancy and be cooked for the rest of your life. So it is the worst single thing that humanity has is smoking. Please avoid it. Stress, I think Dr. Varsha is going to deal with it. I'll just tell about sleep. Now, 7 to 9 hours is the sleep that you require. Ideally, you should sleep every day at the same time and wake up at the same time, at least 7 hours. You should know your place of comfort where you're going to get a good sleep. You should schedule your sleep correctly. You should know what to eat and when to eat before sleep. You don't stuff your tummy and then go to sleep. Have a meal about 1 to 1.5 hours before. Have a moderate meal and make sure that you have 7 hours of sleep. People do take naps, no so-called cat nap or power nap. No harm in doing that. But your cat nap or power nap should be ideally 20 minutes, and by the clock you should get up and be charged enough and go back. So these are the suggestions I have for bed control of your blood pressures without going into the bad stage of going into have medications.
Thank you, sir. So, ma'am, can you now elaborate on how does stress affect blood pressure and what can people do to manage it?
Stress is something that affects people every day. Now, what happens when your body is under stress? The body releases certain stress hormones which affect the body in various ways. On the heart, it increases the functioning of the heart. It forces the heart to work more. It increases the rate at which the heart beats, the amount of blood the heart pumps, as well as it also has an effect on the arteries which supply the body. Now, on the arteries, the effect that stress has is it makes the blood vessels smaller. So, because of this, the BP increases. It can either be transient or it can happen over a period of time. Now, if this repeatedly happens, this can have adverse poor effects on the body, which is harmful. Now, how can we deal with stress? Sir has already mentioned rest. Adequate rest is absolutely essential. Take some time off in the day, every day, to do some activity that you enjoy, which will give you happiness and joy. Avoid unhealthy foods, avoid sleeping late night, avoid smoking, avoid intake of alcohol. Walking, exercise is a must. Along with that, deep breathing exercises, yoga, all these have been proven to be useful in decreasing the levels of stress for every individual.
Okay, so my next question is to Dr. Ramesh, sir. Are medications for hypertension lifelong or can people eventually stop taking them?
Maybe I'm not the right person to answer that. I'm not a clinician, but I will answer my viewpoint on that one. So, as according to the medical guidelines, Indian and international guidelines, see, if the interventions are effective, lifestyle interventions and dietary interventions are effective, so one can, for example, there is a recent research has been done. One who takes 10,000 steps a day, so has a significant reduction in diastolic and systolic blood pressure values, statistically significant. So in such cases, if somebody is strictly adhering to such recommendations and changing their lifestyle drastically, of course there is a chance that lifelong medication need not be taken. But this should be purely a clinician call and should be closely monitored, whether there's a chance that again this hypertension can come up silently and have risk for other complications. So the brief answer is yes, it depends on the intervention and close monitoring.
All right. So Dr. Mahesh, can you add to it?
So now you see the trend is towards having minimal dosage, multiple drug combinations, like 2.5 milligrams of silica, 1.25 milligrams of a conca or of a beta blocker, and 6.25 milligrams of a diuretic. This 3-pill combination is the general trend that is picking up now. It's called low dose multiple drug combination. You have to have one pill that helps. So is it going to be lifelong? If you want to live long, you have to be having medicines lifelong. That is the basic funda behind it. I don't think you can suddenly one fine day decide to stop your medicines. You will land up in a hell of a lot of mess. You will land up with a CVA or a heart attack or a kidney failure. So once we try between the patient and the doctor, they try everything, and if it doesn't work out, please, once you're on medications, then you just have to be on medications. And if you are extremely well behaved, your diet is good, your stress is reduced, your sleep is good, your weight is come down, you're exercising regularly, your dosage of medicines can come down significantly. And there are newer modalities of interventions like renal denervation that has come in. All of these things can significantly reduce the number of tablets. To stop may not be possible, but when about say 5 to 8% of patients, it may be possible to stop. But the rest 90% will have some dose of medicines to continue for the rest of the thing as of the present state. Maybe in future we'll have a drug-free country.
Thank you, sir. Ma'am, can you like we've been speaking about diet, salt, and daily lifestyle, but how do like all these things affect our blood pressure levels? Can you elaborate on that?
I'll try and put it as simply as possible. Now, increased intake of salt has been proven to increase your risk or increase your BP levels over a period of time. Now, salt has the ability to absorb or retain water in the body. So, when salt is present in our arteries, it will absorb the water and it will increase the fluid level which is there in the body. This, in turn, will increase the workload on the heart, can also increase the workload on the arteries. It makes the arteries more stiff over a period of time. Salt also over a period of time has been shown to decrease the ability of the arteries to relax, which is one of the abilities of the arteries which is present. Now, along with that, the outside food or the fast food, they are called ultra processed foods. They are rich in salt, sugar, rich in oil, ghee. All these have also been proven to adversely affect the body. Now, these again, like I mentioned, because of the presence of high levels of salt, affect the BP and the heart over a period of time. Also, they increase our levels of sugars. They cause high levels of sugars, they cause high levels of lipids, and these themselves are known to be risk factors to increase the risk of hypertension. So, like sir has said, avoid eating outside food or eat as healthy food as you can.
All right, ma'am. Thank you, ma'am. So my next question is to Dr. Ramesh again. So why should young Indians be concerned about their genetic risk for blood pressure, like for high blood pressure, even if
Yeah.
they feel healthy?
Thanks for asking this question. It's a very important question, actually. So we hear a lot of, even known person or celebrities, having some gym workout and they're having some issues. So basically, in India, as per the recent study from Indian Council for Medical Research 2 years back, so Indians generally, these NCDs, non-communicable diseases, have a decade before it arrives in South Asian population. It is due to the genetic predisposition of risk. So when I say non-communicable diseases, it's hypertension, obesity, or even diabetes. Such diseases occur 10 years before than they expected in the European population, for example, in the Western. So it is very important to screen. It's not for diagnostic purpose, it's for screening purpose. So we should now the tools are available, so one can with a not very expensive test. Now the technology has improved a lot, so at a affordable cost to a normal layman, so they can do a genetic screening test. Genetic screening tests are like a once in a lifetime test. Our genetic remains the same, so at any point of time, like if one screen at 20 years, one screen at 30 years, even at 10 years, so the result is going to be the same. So if somebody has a family history or having a not very good lifestyle, definitely one should take advantage of these genetic screening tools that are available, and we can know the risk of getting disease much earlier before the clinical manifestation has started. So before the BP readings derange, much before in the lifetime, we can know our genetic risk of developing hypertension in future. So whether we can stop it, may not be, we won't be able to stop it, but we will be able to mitigate the risk of developing it. So we are aware about it, so we can take lifestyle intervention much earlier before it hits. So definitely in the Indian context, young population, definitely genetic screening is it's highly recommended, I would say.
All right. Okay. My last question is to you, ma'am. If high blood pressure runs in someone's family, does that mean it is definitely going to develop in them also? So what is your take on that statement?
So definitely, if somebody comes to us and tells us that he's had a family history of hypertension, definitely it increases his risk of having high BP or hypertension with age. Now, compared to a person who does not have a family history of hypertension, the risk for a patient to develop hypertension who has a family history of IHD is nearly twofold. IHD and hypertension is nearly twofold. They can also manifest with features of hypertension at a lower age than compared to patients without a family history of hypertension. And normally, when we talk about risk factors, we divide them into risk factors which can be altered, risk factors which we will not be able to alter. Now, the risk factors which we can alter, which is in our control, is obesity, being as active as possible, intake of healthy food, smoking, etc. While when we talk about the factors which we cannot alter, that will be the age, the gender, as well as the family history of hypertension. So definitely, family history of hypertension definitely plays a major role in helping us identify who are the patients who are at higher risk of having hypertension in with age.
Right, ma'am. So now I have a set of 7 statements here, and we'll have a Mythbuster round. So you can tell me if that's a fact or a myth. So my first question is for Dr. Ramesh. Sir, if I don't have symptoms, my blood pressure must be normal. So is this statement true?
It's false, completely false.
All right. So my next question is to Dr. Mahesh. Only older people need to worry about high blood pressure.
So if the younger people don't worry about their blood pressure, they will not live up to be old. So it's going to be a disaster for them. So please don't do that. I would recommend that every year get your blood pressure done once at least randomly to see where you stand after the age of 30. Nobody is free from this disorder and nobody escapes. So prevention and precaution is the way to go forward. There is definitely no age group for hypertension.
Right, sir. My next statement is for ma'am. Ma'am, if I am on medication, I can eat whatever I want.
No, the statement is absolutely false. Diet, exercising, as well as adequate intake of tablets all go hand in hand to ensure that your BP is well under the range.
Right. The next statement is for Dr. Ramesh, sir. Cutting salt is enough to control blood pressure.
No, it is not enough.
All right. Next statement is for Dr. Mahesh, sir. Natural remedies like garlic or lemon juice can cure high BP.
Good. So if all the BPs got sorted out by garlic or lemon juice, I would have stopped my practice long time back. So that is definitely wrong. Now the question is, there has been, when we give you a medicine, the patient a medicine, which has gone through various stages of trials, double-blind studies to make sure that there is no side effects, there are good effects, and the patient's BP does come down. So if you do a double-blind study on garlic and prove it to me tomorrow by taking 2 cloves of garlic in the morning, your BP gets sorted out, then of course I'm willing to accept it. So whatever is a natural remedy that has been recommended is in addition to the drug that we give you. Please don't stop our review. And we have a specific problem with garlic. When did you take the garlic? If you take it in the morning, your colleagues will get upset. If you take it in the night, your family will get upset. So I don't know what time of the day you can have garlic, but it's a good thing to have. If you have a preparation that you would like to take, please go ahead. You try whatever is recommended in your local community, but don't stop our medicines. That's all the request was.
Right, sir. My next statement is for you, ma'am. Once my blood pressure is normal, I can stop my medication.
Absolutely not. The mere fact that your BP is normal is because of the tablets that we have given you. If you stop the tablets, your BP will increase again and it will harm your body. You regularly need to come to the hospital, keep your BP checked, and if we feel your BP is low or your medicines can be altered, we will decrease the dose of your medications. But generally, we don't advise any patient on antihypertensives to stop the tablets that we give them.
Right, ma'am. Right. And my last statement is for Dr. Mahesh, sir. Sir, high blood pressure isn't serious if it's just a little above normal. So what is your take on that statement?
So everything starts with just above normal. So you see that just above normal is your warning point. That's when all your red lights should blink. That's when you should realize that you are in trouble. And that is the best time in your life to intervene with all the lifestyle changes which Dr. Varsha and Dr. Ramesh have said. Include your diet, your exercise, your smoking, everything to be done. That is the time you start getting into control. If you don't do it then and there, unless you're genetically predisposed, then you have to start medicines. Otherwise, this is the time for your lifestyle modifications to kick in. You can postpone your date of onset of your drugs, but I think someday it will catch up with you. Till then, instead of taking it from 40 onwards, you can take it from 50, 55 onwards. You can postpone the onset of drug intake, but this slight elevation in the BP is the stage where you require to be counseled, where your genetic study has to be done if it is feasible. And if it is feasible, all that I got to say one word about genetic study is that It is expensive. If it gets done, please go to somebody like Dr. Ramesh and interpret it. Don't interpret it yourself. Even clinicians are not very good at doing that. It should be done by a professional. And if your genetic study is not very favorable, then you should start medicines. Otherwise, lifestyle modification, correct time.
Right. Thank you so much. It was a very informative session. Thank you for your time, everyone.
Thanks.
Thank you.
Thank you so much.